So many of the men in our brain clinic don't even remember they had a concussion. Well, one of the things that happens after a concussion is you don't remember. And some will go home and say, I talked to my mom and she said, yeah, I was in the hospital for 3 days as a 7-year-old kid. That can do it. That can do it right away, or that can do it years and years later. And other traumatic events will do it. PTSD is another traumatic event. PTSD is an emotional event that's very much like taking a kick to the head. It lowers the same hormones, it screws up your brain chemistry the same way. So people can get it from a bad emotional event. We see people that are doing just fine and something bad happens. Mom dies or they're losing a job or something. And that event is enough to knock the heck out of your hormones. So I had one man on hormones, and we had his levels perfect. He was running 38, which is the upper end of the range we want for testosterone. Every year it was 38. Then he's got a 22 in there, and then the next year it's 38. And I'm looking back and saying, what happened? Why was your level 22? He said, oh, that's the year mom and dad had their knees replaced and dad nearly died of a pulmonary embolus. We didn't stop making his hormones. Like, he had problems with low hormones, so we're giving his hormones, and look at this, the stress knocked out his hormones for that time. So stress can do it. And so a lot of the men we see, they haven't got a single event where their hormones dropped off. It usually happens slowly. And one of the ways you can tell about this is that I asked the man, when's the last time you had regular morning erections? And out of 9,000 men that we've seen, one guy could tell us, the other couldn't. If you think back and you're not getting regular morning erections, your testosterone's shot. And you need it to save your life, to reduce stroke, heart attack, diabetes, Alzheimer's disease, depression, and arthritis. You're doing it to save your life, and yes, you will feel better, but sex and muscles is 2% what it does. You're doing it to save your life, and yes, you get all these benefits as well. So testosterone is a steroid. So a lot of doctors say, well, I can't put you on that. That's a steroid hormone. Well, so is thyroid, so is estrogen, so is progesterone, so is your cortisol. So we're all making steroid hormones. But they get the bad name from bodybuilders, weightlifters using high doses of illegal steroids. How are those illegal steroids different? Well, chemically, they've got a methyl group on them. What does that do? It makes them 30 times more potent. We never use that to replace normal hormone levels, ever, ever, ever. So we're looking at something totally different, and that's not what we use. That's why the men using those things get burned out. They don't make any of their own ever, and they get all kinds of other problems from these high levels. That's not the people we look after. We're restoring your testosterone with identical hormones to what you made, and we will get them up to an optimal level, and that's what you need to stay healthy and to not age quicker than you have to.